Hi everyone! The 7th to the 15th of May 2022 is Cleft Lip and Palate Awareness Week. This year's theme is all about the cleft journey. Everybody's cleft journey is different. It really does depend on the person because no two people have the same cleft. But I think the idea behind this year's theme, the cleft journey, is just about showing that a cleft is so much more than the initial repair surgery. It's more than a gap, a scar, or a simple operation. It goes far beyond this because a cleft is with you for life. On average, people with a cleft face a 20-year treatment pathway. I'm 18 now, which means I'm nearing the end of my treatment, which is crazy to think because it's been my whole life really. Clefts can affect way more than I think people realise. There are so many different aspects of living with a cleft, and I'm going to try and show you as many as I can in this video. Surgery is a big part of life for people with a cleft, with most people having their first at around 3 or 4 months old for the initial repair. Depending on the severity of the cleft, surgery can happen throughout life as well. I've had about 6 cleft surgeries and counting because it seems like there's going to be at least one more. But like I said, it depends on the person and some people may have more than that or less, but surgery is a big part of their life. Feeding is something that's pretty difficult for babies born with a cleft. Because of the gap in the palate or in the lip, it can mean that it's hard for them to either swallow their milk or their lip can't go around the bottle or the breast properly, so they struggle to actually get any milk. Or the gaps can actually mean that as they are getting the milk, it actually starts to come out of the nose and out of all the gaps in the mouth. So this can actually cause a lot of babies to become underweight. So feeding is quite a challenge most of the time for cleft babies. Eating can actually be something that people who are older with a cleft struggle with as well. Because of where my gaps were, it actually caused my nose to be quite narrow inside, so I struggle to breathe, which means that when I eat, I have to eat with my mouth open, and it can be a little bit embarrassing or uncomfortable at times. But that's just what I have to do to breathe and eat at the same time. For people with a cleft, learning to talk isn't always easy, and speech therapy is sometimes needed to help form proper sounds. This mainly affects people with a cleft in their palate because certain sounds are more difficult to make. But I had speech therapy because my lip didn't really have the best movement and I wasn't using it in the right way to make certain sounds. So I had speech therapy for a little while just to kind of help me with that. Something else that can affect people born with a cleft is hearing difficulties. So cleft patients will have to go for regular hearing tests to make sure that there are no difficulties. Because certain issues are possible, people with clefts are more susceptible to getting glue ear. I was lucky enough to not have any hearing difficulties because of my cleft, but I have had my hearing monitored throughout my whole childhood. Dental work is another big part of life for people with a cleft. Clefts can cause missing teeth depending on where the gaps were. I, for some reason, had extra teeth, so that could mean having teeth removed or having extra teeth like false ones put in. And more often than not, people with a cleft will have to have braces. Braces are used for certain operations like the bone graft and I think jaw surgery. And then also because clefts can really affect how your mouth develops, teeth can be everywhere and they usually will need a lining with braces as well. And this can be quite a long process. I think I had braces on and off for about 4 years, but I do think that it is worth it. As I briefly mentioned before, breathing can be an issue for people with a cleft as well. For people with a complete cleft of the lip, it usually affects the nose, and in my case it did, and that meant that my nose didn't form properly. So inside everything's quite narrow and it can be quite hard to breathe sometimes. So this is something that is probably going to need fixing in the future with an operation. And finally, one of the aspects that I think seems to be the most obvious for people is that clefts affect appearance. Cleft palates not so much because that all kind of happens internally in the mouth, but cleft lips definitely do change the way people look. But again, this is not just as simple as having a scar, because looking different does have its consequences. I have personally been bullied for the way I look, and I know a lot of other people do get the same. And this can cause low self-confidence, and it can really take years to come to terms with. So that is cleft life in a nutshell. As you can see, it really is a journey, and it's clearly not something as simple as fixing it with a little operation. Clefts really do have a lifelong impact. For more information or support, you can visit the Cleft Lip and Palate Association's website, and they are a great UK charity who support people born with a cleft and their families. This is actually my 4th year of making a Cleft Awareness Week video. If you want to see the others, I will link them in the description below. But that is it for today's video. Thank you so much for watching. Keep spreading smiles, and remember that every smile has a story.